podcast listeners, and welcome to this edition of Pregnancy Help Podcast. I am delighted to be welcoming Michele Marsh with us today to speak a little bit about her program and some of the things that she has learned along the way. We're really excited to have you, Michele. Thanks for jumping in.
Well, greetings, everyone. As she said, my name is Michele Marsh, and I'm the director of LifeHouse Crisis Maternity Home here in Springfield, Missouri. LifeHouse is a 24/7 residential transitional housing program for homeless pregnant women age 18 and older and their infants and young children under the age of 5. So here at LifeHouse, residents receive safe shelter, food, prenatal and post-delivery health education, comprehensive individualized case management, counseling, individual and group, life skills education, including budgeting, assistance with transportation, continuing their education, finding employment, and housing. And we hope that all contributes and results in improved pregnancy outcomes for both mom and infant, a reduction certainly in homelessness and poverty, and a reduction in child abuse and neglect for the high-risk population that we serve. So LifeHouse is a relatively young program. We're only 6 years old as of this last December, right after Christmas.
Congratulations on your anniversary.
Oh, thank you. Thank you very much. Over 60% of our residents are considered chronically homeless, and many are second and third, and now, unfortunately, fourth-generation families that have been living in poverty and experiencing homelessness. And so because of that, and because we're a place that our individuals are homeless and have, prolonged periods of time with that issue, they also have health histories that are extensive. So they come to LifeHouse with poor physical, dental, mental health because they've had years of little or no health care and years of abuse. So over 70% of our individuals that are here at LifeHouse, they have histories of domestic violence and addiction, with many of them using drugs during their pregnancy prior to entering LifeHouse. Most of our ladies enter LifeHouse in their second or third trimester, although they can come anytime during their pregnancy. And last year, in reference to what I just commented on, last year in 2019, there was actually an increase in our residents, the percentage of our residents that had drug addictions during their pregnancy and certainly before. So it was up to 79% of our residents had histories of substance addiction last year. And we all know, certainly LifeHouse and other places assist women in getting treatment and staying sober. So here at LifeHouse, that actually has turned out to be one of the things that we do for not all, certainly, but many of our ladies. And as you know, and everyone else would know on this call, this is especially important during pregnancy. So as I mentioned, women come to LifeHouse at various times during their pregnancy, and they can stay here for up to a year following the delivery at no charge while they continue to work towards self-sufficiency. So really that means is that even though we don't charge them anything, they do agree to actively participate in their program and honor what we call agreements and expectations. So all we ask is that they are active participants in doing the things that they tell us they want to do when they come here, and also the things that we need to do, any of us as individuals, whether you're living in a sheltered environment or any other environment, there's certain things we need to do. So on that note, everybody gets a job, saves money, finishes school, and much more. That's where a lot of our classes come in. We also assist them, moving into their own housing, and once they do, we help them find affordable, safe housing, and also help them in many ways to provide at least most of their furnishings. So that leads us to the next phase of what we offer here at LifeHouse. It's almost kind of a program of its own, although there's a continuance from residential to what we call aftercare. So after they complete their time in residential, which could be that year after the baby's born, and a few of the ladies will move out sooner, but if they've done the things they need to do, they have the opportunity to move into what we call our aftercare program. And in aftercare, they can be in aftercare for 2 years, which is certainly a long time. But in aftercare, case management and actually the same case manager will follow this individual, and support services continue. So in aftercare, what that means is that they have access to case management, counseling, health services, resource connections, and a lot of other, LifeHouse specific opportunities like the classes and sometimes donated items we can still provide for the individuals in aftercare. Basically, aftercare is designed to meet a gap, something that's been identified probably since the beginning, but more consistently in recent years, and that's that a lot of times we help people up to a certain point, but then they're kind of left on their own, and they don't have that opportunity with some support system to help them stabilize, and that's really what aftercare is designed to do. So, its primary goal is to promote stability and independence and ultimately assist these individuals, the ladies that we serve, to help prevent them from returning into homelessness. So, certainly I could give examples, and I'm sure many of you could think of some. But even in aftercare, there's accountability, as they don't come by and just get things. They still see their case managers. They're still working towards certain goals. And though they can access services, if they have certain issues, they become more and more independent, and there's expectations for them to. A good example would be not very long ago, somebody had some tire trouble. Well, we didn't want her to miss work. We didn't want her to get messed up at childcare. We knew her funds were limited, so we assisted a third of what she needed. A donor was able to assist us with another third, and her part of doing the things she needs to be able to do on her own completely at some point was that she contributed a third. But yet, if she went a couple of weeks without a car, without, doing what she needs to do at her job, she could easily lose a job, and then that spiral begins over and over again with something as simple as needing tires. And that's something that many of us take for granted, even though we know that that expense is not always easily met. But for most of us, we know that that's something doable. Or we have others in our lives who can assist us when we're challenged at different times. But because, when I talked about all the history of our ladies here, most of them really don't have positive relationships when we meet them, and sometimes they're pretty dangerous relationships. Now, I will tell you that some of the ladies do reunite with family members who are, for whatever reasons, they lost those relationships with family, and sometimes that's definitely easy to understand on both sides. So it's a non-judgmental environment. So they do reunify sometimes with children who are living elsewhere. We have reunifications here, and they definitely reunify with family members. But I will say that a lot of our ladies, they really don't have family members that it would be positive for them to reunite with, i.e. abusers, etc. So I'll kind of leave, that piece on that note. It's important for you to know that LifeHouse, when I talk about the services we provide, we have 2 full-time case managers. They're both social workers. We have a full-time nurse, a part-time licensed professional counselor, full-time live-in staff, and we actually don't use the house mother model. I'm often asked that. We use a different model, but she does live here. Part-time cook, and on-call staff, and of course additional support staff, and we utilize, thankfully, many, many wonderful volunteers. We can accommodate up to 19 women and their infants and children. And I will just, reflect a second on the on-site part. So if you could see us, we literally, most of the offices are literally across from the dining room and next to the kitchen. The other offices are downstairs next to the community room and the laundry room. So we don't see our residents just once a week or once a month. We literally live with them. So there are multiple interactions and encounters, and I think that's partly what is a positive about our program here.
Yeah, it sounds like there's a lot of different multifaceted, things going on, and how exciting. I know you're a part of a bigger organization too, which you can tap into those resources and connections, and what a blessing to those women as well.
Yes, yeah. LifeHouse is actually a program of Catholic Charities of Southern Missouri. So Catholic Charities is certainly an old ministry, but Catholic Charities of Southern Missouri for Catholic Charities is relatively young. We're celebrating our 10-year anniversary, so we're pretty young for Catholic Charities. And kind of on that note, that's where, when we were visiting before, I had mentioned that we have multiple offices across 39 counties in southern Missouri. So for us, it's a lot of there are a lot of needs. 10 of those counties are traditionally the poorest counties in Missouri, and just geographically, it takes 6 hours plus to go from our most western office, to our most eastern office. So it's just a lot of needs and a lot of territory to cover in that regard.
Yeah, my goodness. Yeah, what a huge region. I understand that you recently pursued accreditation, which is a big deal, and received accreditation. So, congratulations on that. That's a great accomplishment. I know some of our homes at least consider it or think about it. Can you just tell us really briefly, what accreditation was like for you and why you chose to pursue it?
Oh, certainly. Well, the Council on Accreditation is one of the agencies that provides accreditation for nonprofits. So what it is really, basically, it's a formal evaluation of a program or organization against best practice standards. So the accreditation process, it provides like a framework for organizations to sometimes begin, for others to continue to improve and offer evidence-based best practices that support their clients and local communities. So it is a huge endeavor, and that I think maybe, I don't want to say scares, but maybe intimidates, people a little bit. It does take time. Typically, I think the average amount of time that it takes to work through the accreditation process is about 18 months to 2 years. And so what you're doing really is looking at, depending on how your program is designed, certain standards of care. So an example would be that Catholic Charities, all of Catholic Charities of Southern Missouri receives accreditation. So there are things like administration, HR, ethics, all those kind of things that, reach across all programs. But specifically for LifeHouse, we had to meet the standards that were more specific and applicable to the type of work that we do here at LifeHouse. And so we met and actually excelled, I'm pleased to say. We have a wonderful team here in the standards for pregnancy support services, shelter services, and behavioral health services. So I would tell you that it was a lot of work, but in some ways it wasn't that hard, because they are the things that we all are either doing or know we need to be doing and want to be doing. It just, it's all scheduled out, and you have to, instead of saying, oh, I know I need to redo that policy and procedure, or yes, we do that, but I need to get it down on paper, then it kind of, it's that driving force to meet your deadlines that, yes, I need to get this done. So consequently, when you're done, it's wonderful because you've really, you've really kind of, put your feet to the ground and said, yes, we do this. We're doing a great job. I love what we do, but definitely there's no agency in existence that can't improve. And so, you have to read a lot of material and go, oh, well, that does apply to us. Maybe I should give that some thought. Or, no, maybe not, or maybe I don't understand. So it's a great educational process. So I would say that for some, maybe it's not quite the time, and there is a fee involved as well. For others, they probably put it off and maybe need to talk to some agencies, and we did. We visited with several agencies and kind of asked their thoughts on it, and there are classes that they help educate you in that process. So it's worth at least, delving into if you have that desire. And I think for us, you don't have to do it, and you don't get any extra money for doing it. But I think it is a driver more and more as grants, donors, just money streams become more competitive and more challenging to get, that I think it also speaks to those individuals in saying that we are dedicated to high standards of care, and that, we've worked through this process. So, I think that helps you become a little bit more competitive. And from a grant perspective, there are a few grants that you have to apply for every year. If you do have your accreditation, you can apply for that same grant every 3 years. And so that gives you a little less work in some ways, because they know that you have already met certain standards. So they kind of give you a break on, applying for the same thing every year. They'll give you, 2 years or 3 years to reapply and still provide the funding.
Well, that is, congratulations. I know it's a huge process and a huge undertaking. You have to kind of look at every aspect of your work. So, thanks for sharing a little bit about that. And if folks ever want to explore it, I'm sure you'd be open to talking about it more.
Yes, definitely. And we had people here too, not so much in LifeHouse, but in the broader agency. There was a lot of discussion before. Not everybody was sure it was something that we needed to undertake. And we talked about it for a long time before we actually sort of jumped and pursued it. So definitely we'd be happy to answer questions for anyone.
Awesome. Thanks, Michele.
Sure.
So I understand that you have the chance to think about growth, which is always an exciting organizational step, and that you have the chance to be doing some work related specifically to thinking about a second location, and even doing that second location from scratch. So that's super exciting. I know a lot of homes you kind of have to work with what you get, work with the opportunity that becomes available. And then it's a special moment when you get to think about what exactly do we want our home to look like. So I know you're in a great facility with your first location, and I'm sure it works for you in so many ways. But I was kind of curious to hear, as you think about a second location and you think about being able to build from scratch, kind of what are some of the things that are going through your head?
Oh, well, you're right. It is really exciting and a little bit daunting. So, now that we've been here for 6 years, we are kind of met our stride, so to speak. Not that we aren't trying to figure out things and improving, but in terms of facility, we've figured out, most of what we can with what we have to work with here. So with this facility here, it is actually about 55, 56 years old. So we are housed, and thankful for it, but we are actually housed in what was formerly a Carmelite monastery. So that's where the Carmelite nuns lived for over 50 years. And they were contemplative, so really they spent more time there primarily in prayer. And during most of that time, this side of Springfield was really not developed. In recent years, it has been much more developed, and that's partly why they left. But so if you think about that, if you think about how old the building is, one of the hardest things here in adapting was, everybody has a computer. Everybody has telephones, just the technology pieces and the wiring. We are basically in a really sturdy, wonderful concrete brick building, which is great during storms, but not so great when you have to connect everybody to technology. So that was probably one of the hardest things when we moved here. They had one phone, and because they were minimalists and not interested that much in sort of the everyday going on, activities of daily life around them, they would probably just have one phone if they were still here now. So that was kind of one of the big challenges here. And storage, they were minimalists, so storage has been limited. And it was built for sisters, nuns, and not for children, so we've got small children. We've had to adapt a lot of safety places, gates, and we have stairs and still work with fire code. So, although we love this place, and I will tell you honestly, we have 11 plus beautiful acres and an amazing garden that the girls and staff and also volunteers help us with. But we're thrilled to be able to build a second LifeHouse. So, a couple of minutes ago I mentioned that we were spread from essentially in Missouri. If you would look at a map of Missouri, the southern part, you would see Joplin, which some people are familiar with, to Cape Girardeau on the east side. That's kind of our range. We have offices in between at different locations. Well, in Cape Girardeau, the mortality rate is very high, and it is surrounded by the highest economically challenged counties in the state, the poorest counties in the state. So even higher need than some of our other rural areas. And again, a lot of work to be done. The community is really asking for assistance. And so we'll replicate some of the things that we do here at LifeHouse, but also individualize it to fit that community and their needs and their resources. But it's such a wonderful opportunity, and we're just thrilled with this chance. In fact, Monday, I was on a telephone conference call with the architect and our executive director for Catholic Charities, working on plans. We do actually have the property, so we have a location, and, finances will be huge, but, things are definitely in motion. So that's when we have here at LifeHouse, the sisters, a shared bathroom area. So a couple of ladies share each unit, and so that's actually worked very well. It's pretty good size, and it's very private. But having said that, the new LifeHouse will have individual, bathrooms connected to each bedroom. They'll be a little bit bigger. We've certainly taken the children's aspects to heart. And so we have play areas here that are perfect since we have a beautiful property, but definitely we've accounted for that, moving into the new LifeHouse. Storage, bigger pantry, access, and definitely to keep in mind safety, given, a lot of the histories of the ladies that we serve.
Yeah, a lot to think about as you do that. That's an exciting process. So thanks for giving us a glimpse of it. You mentioned earlier that a large percentage, I think 79% you said, of the women coming into your program have significant addiction histories in all the things that accompany that as well. So curious to talk a little bit about maybe some of the programmatic decisions that you've made. I know across the country, homes are definitely seeing more and more calls from women with addiction histories and are trying to wrestle with how to best serve these women. I know you're a fairly new program and that you've only been open 6 years, but have you seen, as you've welcomed more and more women with addiction past, have you seen any major programmatic changes?
Yeah, I think part of it has to do with more subtle changes, and part of it has to do with almost, not predicting and not vision, but looking towards the future and trying to make sure that we can meet those needs and still meet the needs that we're already meeting. So I think one of the biggest challenges is that, it'd be one thing if we served only ladies who had those issues and those histories. Then you could develop certainly individualized care, but a more uniform program to really target certain areas. So because we serve quite a variety of ladies, and that particular issue is on the increase, we've had to really look at that. What do we want to change maybe moving forward? So along that note, when we've always had in our short 6 years, it would be that there'd be maybe 72% of our ladies involved with significant drug histories. So I'm not talking about 1 year. I'm talking about years and years and years. It might be 5 years. It might be 10 years. It might be 15 years. I mentioned that our ladies needed to be 18 and older, so we've had ladies here, just a couple of 18-year-olds. Our average age runs in the mid-20s, like 26, 27, and we've had 2 ladies deliver in their early 40s. So quite an age range and a multiple need range. I would say that no one that has come to LifeHouse just has one, major issue. There's, like I said, pretty extensive. It's like critical care maternity homes sometimes, I think, with the longevity and the severity of their issues. So, kind of back to the substance abuse piece. So now, last year we were at 79%. Well, what that tells us is that we need to continue to do some of the things we're doing. We work with all of our community partners, so some of the ladies have like day treatment, outpatient treatment. We do drug screen here before they come, and certainly random drug screens. We have always had a counselor here at LifeHouse, but we've we've had to develop those services a little bit more. So we have a licensed professional counselor, so some of the basics are that everybody has certain classes. I don't think really anybody comes here with much, if any, self-esteem. So everybody has self-esteem and anger management. So those are some of the relationship, classes. So those are some of the basics. But then we've also had to really focus more on some of the other classes that benefit, individuals with substance histories. So that's been one of those more developed pieces that we'll continue to develop. Everybody gets individual and group counseling here. That's part of what they agree to. And then certainly there are a few people that need, additional services, like maybe a psychiatrist as well, and we'll try to make sure that they're connected. One of the things that some of you listening may not realize or give much thought to, and you really need to, is that as we serve these individuals, safety is critical for everyone in your building. Staff, other residents, the children, the babies, and the people that, that have these histories. So a lot of things along the safety spectrum. And one thing that sometimes people don't think about is that we're not talking about ladies who are pregnant and we need to help them keep track of their prenatal vitamins. We're talking about individuals who have a lot of medications that are controlled medications. So we house them in the office, and we do lock up the controlled substances, but we are housing them for the ladies. It's more that we're taking care of them for safety purposes, so we don't want them in the rooms, we don't want the kids to get them, we don't want anybody else to try to get them. So we're housing them, but even housing them, you have to keep track of them. You've got logs, you've got, to keep them locked up. It's not the same as a hospital. We are not dispensing. We don't ever act like we're dispensing. We don't want to dispense. You would have to have somebody provide oversight, which some places do that. That's not something we're interested in or have any intention of doing. There's some medical things that we could do here. I would remind people to stay within their scope. There are a lot of things that we actually just happen to have people who have certain credentials. But with that, with the medical pieces, we are literally, a mile, less than 2 miles from each major hospital in our community, and not that far from an FQHC here, which is as large as a hospital. It's huge. And so there's no real reason to do some things here. So I would caution all of you to not put yourself at great risk and not provide services beyond your scope for multiple reasons. Main one, we don't want to hurt anybody. Two, there are a lot of liabilities involved as we begin having more complicated circumstances and histories with individuals. So I would say, please think about that. And now, pregnant women who have opioid histories, one of the more recent years, treatment involves medication-assisted treatment, and those medications are controlled substances as well. So, again, there's a lot to think about, a lot involved. It's all doable, and we haven't had any big issues, but you just need to take that into consideration. And I think, one thing our counselors, and I know we have the luxury of having a licensed professional counselor on site. I know that's a wonderful thing, and I'm so thankful for that. But the counselor has also been very helpful working with the staff in terms of self-care, but also in terms of helping everyone understand better trauma-informed care. So that's not new. They've talked about it a lot more probably the last 10, 12, 14 years, and heavily, all kinds of seminars on it, heavily, the last, 8 years maybe. It's not new, but I think it's sometimes misunderstood. But it's a really important piece of what we need to know when we're helping individuals, not just with addiction histories, but more, again, they've had some really tough traumatic histories, and certainly a lot of the ladies that all of us would see would fall into that category. Maybe not to the extent that, some of our ladies have, but definitely, even in their own homes, there are people with a lot of trauma or, people kind of borderline and falling off the edge. So a counselor, if you have one or if you don't have one, you'll need to really consider those pieces as well from a staff perspective.
Yeah, no, great advice. Speaking of advice, as a wrap up, a lot of our startup housing groups are kind of active listeners for the podcast. So I'd love to hear your thoughts just for our startups in particular. I know you've been with LifeHouse since its early days, so just kind of curious to hear what advice you'd offer for folks that are kind of getting started in this work, or maybe something that you had to learn through your own experiences, but just some advice to give to our startups.
Well, the learning began the moment I took the job, and probably before, because I actually prayed a lot, because I was fortunate. I'm one of those people that was fortunate in that I loved the job I had before I came here. So I think it is a job, technically, but it is also a vocation. It is also a ministry. But having said that, I think that you can't forget our responsibility in terms of what I mentioned earlier, quality care and standards of care. So we want everybody to have a great big heart, but we still need to maintain boundaries and still do, the things that we say we're going to do and that we're called to do. And I would say, one of the biggest things that I've seen, because occasionally I do get calls from people in other towns or other states, and one of the biggest things I've seen, and I would say that LifeHouse did this a little bit too. So here's a piece, I don't know if it's exactly advice, but I would encourage you to take the time you need before you start, before you open up. It is much easier to make sure that all of the essential elements for your home are already in place. It doesn't mean that there isn't ongoing development, or there aren't ongoing ups and downs and all arounds. That's going to be part of it. But, you need a strong foundation, and I would encourage you to work on that before you open. And I think that's because we all have this sense of urgency. I do too. So it's not unusual for people to open a maternity home without really being ready to open. The needs are high. We want to help. We're pretty sure we can make it work. But again, make sure you have the time that you need. Allow yourself that time to think about what you need and develop a plan to meet those needs. Decide what kind of home you want to be. We have longer stays and, kind of a longer program, but we're young, so we'll see where all of that leads us. If you can't do that, there are lots and lots of ways to help pregnant women and their families. We're not all designed to do the same thing. And so, again, short or long-term services, look at your community, where you're going to build it, or what facility you're taking over, or what home. So look at your community and your community partners. And this is a big one. Decide what you want to track in terms of data. So it doesn't seem like the most important one, and it isn't compared to some things, but it's just much easier right from the beginning. Again, you'll develop it. There'll be other needs, but more and more, again, grantors, donors, people want to know numbers, and they want to know that whatever they're providing is making a difference. And to do that, you can talk about it, but really, people want to see numbers. So I guess another really huge thing I would say, and this is like not lessons learned. I always knew this from other things that I've done, through my life, but it's been especially important in this setting. So, staff expectations, what you expect of them. It's not the easiest place to work, and training is critical because sometimes we can't pay the wages. We pay good wages, and I bet most of you do too, but maybe not like some places, and you have to kind of, really think about your training. And I think sometimes people put training and orientation on the back burner, and I would not do that. It will cause problems. And, whatever you can do, those are things that you set up too. Your staff, we owe it to them to train them. And also, make sure that, because we think about the things we do for our residents or clients, but sometimes, the things that we need to do to help our staff and our teams be successful and be the best at what they do, they need training as well. And I guess, it is expensive. So again, think about what you can do so that you don't go under. I can name, without barely even thinking, 3 maternity homes that didn't last very long. So we definitely need more help in this arena. There are lots of people that need help. But, just think about what you're doing. Consult others. I want you to be successful and, and be in it for, the long run. So think about your volunteers too.
Oh, we could talk a lot about volunteers.
Yeah.
Michele, thank you. You've got some really great things going on. Congrats on the accreditation, on being able to think about a second home. That's super exciting. On 6 great years of service. So, and thank you for just sharing a bit about the choices that LifeHouse has made and a bit about your program. It's fun for others just to get a sense of kind of what's happening in other programs. So we're really grateful for your time and your expertise on being with us.
Yeah, thank you very much for all that you do and all that Heartbeat does. I think one of the most important things that, Heartbeat and you have been instrumental in, in recent years is building that community of people who work and build and, are involved with, who support maternity homes and transitional housing services. So, there is, as we've mentioned more than once, great need, but there are also a lot of resources and different ways to meet those needs, and I think that we're smarter and better, when we work together and try to figure out these things and share our experiences. So bless you and Heartbeat, and thank you for all you do.
Oh, thank you so much. We're definitely all in this together. So with that, we will sign off of this edition of Pregnancy Help Podcast, and we'll catch you next time.
Thanks for listening to this episode of Pregnancy Help Podcast. To subscribe to future episodes, access resources related to today's session, or listen to previous episodes, visit www.heartbeatinternational.org/podcast. Thanks for tuning in.